Hi, everyone. Welcome to today's Career Chat. I'm Krista Harmon. I'm one of the Career Readiness Consultants with the Kent Intermediate School District. And I am so thrilled to have Pam Sebright, a registered medical assistant, with us today. Welcome, Pam.
Thank you.
So Pam, medical assistant is a really hot job, I hear. Lots of openings out there. Take us back to high school. When you were thinking about careers, did you think you'd be in such a hot career?
No, I had no idea. It was a long time ago. I did mention to Krista, it was 1982 when I graduated from high school, and life was a little different back then. I wanted to be an oceanographer. I really wanted to do that, and we really don't have a lot of that here in Michigan, but I was kind of forced to start college and high school. My father was disabled, and the president at the time, Ronald Reagan, had passed a bill that allowed me to get started early. So I had all my credits but one class. I chose the program at Davenport, which was amazing, and it's changed since then. When I went, it was pretty rigorous, and we were trained in clerical, clinical, and laboratory, and also billing and dictation, which now those are their own fields. But as you said, medical assistants are they're a hot commodity. We are constantly hiring. And there's a wide range of things you can do as a medical assistant. And in dermatology, I even do stitching for my doctors, anesthetizing. I don't do any cutting, but we have a wide range of things we can do. And we can have different levels too. We have a Mohs surgical assistant, which is what I am, but I also do cosmetic procedures. And again, I don't inject Botox or do fillers, but I might consult for those patients. But I do lasers for hair reduction, among other things, and chemical peels, microdermabrasion. So that's kind of fun. Then I have my own schedule, and I can I'm done when I'm done. When you're with the doctor, you're done when the last patient leaves the building, and your scripts are called in and that type of thing. Or now they're e-scribed, so we're all electronic.
Well, there's lots to dig in that, and I'm looking forward to fleshing this out for them. So when you were in high school, how did you decide that the medical field was for you? How did that decision come about for you?
Well, I always wanted to help people. I was the youngest of 6 children and like to be making everybody happy, and still tend to be that way. But I did want to help people. And when that program was available, that just was a perfect niche for me to go into. I always had thought about going on for nursing and getting my RN and my BS on. But then you have a family and things happen. But I love my job. I've been in dermatology since 1983 and I love every minute of it.
And I love that you've been in this particular field. When you graduated from your program, how did you know that dermatology was even existed, or did they help you make that transition to an internship? Tell us how that kind of transition, because that's something a lot of young people know about.
Right. So we do have to do an internship, and mine was for a family doctor. And my first job was with a family physician. She had been pregnant and was getting back into the swing of things. So she was working just 3 days a week. And I did everything. I checked her patient in, I took her patient back, I ran their pulmonary function test, I checked them out, I even did her taxes. And then her husband wanted to leave to a sunny state of the South. And then I interviewed for a derm office in Kalamazoo, was hired on the spot. And I initially worked at the front desk. And then one of the nurses broke her foot. And so being a medical assistant, you're so versatile. At least then we were trained that way. And then I went into assisting in surgery, and then made a move to Kalamazoo and was hired by a different practice, Dr. Evelyn Vanderveen, who passed away suddenly in 2018. And then we merged with West Michigan Dermatology, who we are now. And that's when you talk about surprises in your field. I'll tell you, losing your physician who you've been with for almost 20 years, that was devastating. And then feeling displaced, not knowing where I fit in the practice anymore. But it all has come around, and we went from paper charts to electronic, which was had a little anxiety over that. So you keep learning. And that's one thing that makes a good medical assistant, that you're willing to evolve and roll with the times. And there's a lot of help that they will give you to get there. It's not all on you.
Yeah, I think that's a couple good points there too, that sometimes there's so much pressure on young people to figure it all out, that just to hear that it's a journey, like that you've been in the field, but things happen out of your control, and yet you still land on your feet. You had a good credential that gave you the flexibility, and even starting at the front desk, and then they pulled you to the back. That we don't have to have it all figured out. That's part of life, and things will unfold. And I'm definitely going to dig into some more traits of what makes a good medical assistant. But I appreciate that training. I know that today it's still a very somewhat short-term training, usually about 2 years. I just wanted to put a plug in for the young people that Michigan Works has an apprenticeship with medical assistants. So you actually get paid, you get hired by one of our local medical hospitals, and they're going to be training you, and you're getting paid the whole time. And that's what an apprenticeship is. You're learning while you're earning while you learn. So I'll give a resource at the end to look into that. But Davenport, right, still has their program, right? As far as you know, Pam? Yeah.
They do.
Yeah. And again, so many postings. Some have sign-on bonuses. This is a field that, again, you don't have to go in huge college debt to get into it. They're in demand. You can write really whatever specialty area you want to get into is really the way it works. So heads up for young people as you're looking to the future. So just take us through, not that you have a typical day, Pam, because I'm sure you don't, but what do you do each day? Kind of give us the breakdown of what a medical assistant is. And now you're more experienced, so maybe you can even help us understand what some of the newer MAs do, because maybe you've evolved to higher responsibility.
Well, we have a very large practice now. We have 3 locations, and you should be flexible, is what I should say, to rotate from provider to provider, from location to location. So the average day is for any one of us to get to the office a half an hour before your provider starts, because you have rooms to set up, you have trays to get ready, xylocaine to draw up. Within dermatology, you do a lot of biopsies. We do that on the spot. It doesn't take long.
What is a biopsy for some young people that might not know what that is? What do you do with that?
Sure. It's when, say, you have a mole that looks suspicious and we want to cut it off and then send it in for evaluation to the lab. So then we find out if your mole is bad, if it could be a life-threatening melanoma, or we have a lot of elderly people that come in with basal cell carcinomas, which are not life-threatening typically. Squamous cells can also be of concern. So we like to get those removed right away and then tested. And then if they need more surgery, then they come back for more, which our surgeries we do, it's a clean technique. So, you know, you might think, how are they doing surgeries in an office and not in the surgical center? We don't do any sedation. Although I will say we recently got some nitrous oxide that helps for some short procedures. And that's like what they use at dentist office that make people kind of feel silly. And it goes away real quick. But mostly we just use local shots to numb the skin. We can take the spot off in just a moment. We don't even have to wait. And then they just get a Band-Aid and go home. So there's a lot of that. But now that we have electronic medical records, we all walk around with our iPads. And really the medical assistant is entering all the information almost before the patient leaves the building. So what in the old days, doctors used to dictate in a little machine, and then you'd have someone type it all out and put it in a chart. Now we're entering everything. So the terminology is important, understanding the specialty language, which Davenport, I have to say, was amazing in teaching terminology. They have a great knack for giving you clues on how to put a word with another word to help you remember better. But as for the day, then you're pretty much with your one patient, you go in with your provider, you stand there, you're typing on your iPad, and then you're having to print forms off if you're going to do a biopsy. But literally a visit can be 5 minutes, can be 8, can be 15, could be 20. Really, they're very quick, but then you also have plenty of other staff that usually there's 2 to 3 medical assistants to one provider. And that helps a lot. And then you have to clean your own rooms though. And then especially now with the pandemic, there's a lot of extra that we even are doing, but we've always done a lot of cleaning, but now there's even extra. And then you have emergencies that come in that end up taking longer. So I mean, there's a lot of days I don't mind working through lunch. I prefer to just keep plugging through, but of course, everyone gets a lunch that wants it. And then often our days can end sometimes at 4, sometimes at 3, sometimes at 5. A lot is due to the provider, but when I'm in surgery, that's a little different because those can go longer.
So your job, you have weekends off, I assume then?
Pardon me?
Do you have weekends off?
Oh, I do. Yes. Yeah. Yeah. We don't work weekends.
Yeah, I want young people to understand that there's some settings that you're working 12-hour shifts and holidays, but there are some, like dermatology, that you're off on the weekend. So that's just a little bit of tidbit for you today as you are kind of taking all these different occupations in. I have a question for you from Jasmine. She's wondering, do you help a patient often by yourself, or do you have to have a nurse in the room or that physician in the room?
No, I'm often by myself with the patient. The doctor will be coming in or the physician's assistant. But it's brief. But if ever there was an awkwardness that you felt you needed to have someone come in, there's great communication. And communication, that's the word for any job. And it just goes a long way. A lot of people think, oh, I'm just going to do this. I'm going to hurry and do this. It takes too much time to say a no, to do whatever. Communication is key. And as much as people don't like a lot of emails, it's a great way to communicate. So always ask questions, always let someone know what you're thinking appropriately, not when someone else is in the room, like the patient. I'm not going to say something inappropriately. I can write it down on a piece of paper and let the doctor know. But yes, you can be in a room, definitely, with a patient by yourself.
Yeah, and it sounds like because of your level of experience, we were talking a little bit before we started. Give some examples now that you have 20 years on your belt. What are some of those things that you're doing based on experience and maybe even more training that some of the younger, newer ones aren't doing? How does this career evolve for you?
I have to say, I feel that some of the younger people don't maybe listen as much to their patients, take the time. It's so important to look someone in the face. And now that we have to wear masks, unfortunately, they can't see your mouth moving. And a lot of patients come in and they're very anxious. They might come in grumpy because they're scared. And it just takes a smile. It just takes a nice gesture, that popping in and saying, hey, I'm sorry, we're running behind. Is there something I can get you? Especially if they're sitting there undressed. They really appreciate it. People think a lot of things. They think you're off if they hear laughter, that, people aren't doing their jobs and they're leaving the patient sit there. I do feel that sometimes that side of interpersonal communications has been lost a little bit. And then I think too, people are nervous with their new jobs, and it is hard. Those things will come. I'm quite comfortable with my profession because I've been doing it so long. But yes, just take time, let people know that you care, even if it's just with something very simple, like just checking in on them.
Yeah, it sounds like that communication piece. I like the examples that you gave, even with the eye contact and a gesture with your patients. Just going a little bit more on the skills side, Pam, because you've been in this career longer than, some of the other newer ones in your office, what are some ways that your job evolves? What other responsibilities do you get to take on once you've been there for a while?
In our practice, the providers, our doctors that own the practice and manage it, encourage every avenue of education that you want to do. The more, the better. As for, really, I feel like our practice has been even great with people that don't have a lot of experience. When they see the potential in that person, as we've merged, which has been quite a transition of one practice that had probably 70 people, now they've added 30 more people, and people that didn't know how to do electronic medical records. I mean, we were still using paper charts, but they have plucked the staff that they see good managerial potential in. I mean, one of the young girls, she actually had, I think it was business associates, She did like what you were talking earlier with the Michigan Works, but she did it here at our office. So she worked in the back, which is our clinical area, assisting the providers or the doctors or the PAs, what I do. And she learned on the job. And after doing that, because she had that associate's for so long, she can then become a registered medical assistant, which I took training for that in a school and paid for that. You know, she was able to learn it on the job, which was great. And she's a wonderful asset to our practice. She's young. So it's not just someone with my experience being able to do more. There's a lot of potential when you show it. And when I think our practice is excellent at noticing that in all of our staff, whether they're new or whether they're older.
Well, I appreciate you giving some insights into the education. Someone had asked about what is that education needed to do this. And again, I believe in most cases, it's between 18 months and 2 years training. I know GRCC has a program, Davenport, and that's a simple Google to put medical assistant programs, Grand Rapids, Michigan. That's a way to find some of the different ones that are out there. But that apprenticeship, again, learning on the job is one way that people get in. So thank you for giving some insights on that. What do you think, as far as qualities that you've seen in yourself and other really good medical assistants, what kind of traits, personality traits or skill sets do you think are needed?
Organization. We like to joke about being OCD because we all have particular things that we want our room to have and the way it's laid out, and being able to recognize that and respect that in your coworkers, because we're also dealing with medical records. We are documenting. This isn't a sloppy thing that you're going to be entering information in a chart. And so, and yeah, being a neat freak is great. We love them. The neater, the better. And yourself as for coming in and being clean, being on time, and then in your rooms having that ability. And of course, again, communication is so important. What else? Being efficient. And some people, we've had some slow people that don't make it. You know, you have to be not just necessarily quick-witted all the time, but be able to multitask. Okay, that's a must. You have to be listening to what's going on around you as well, and know that, okay, I gotta quick go over here now and help this person in room 14. And I know my patient's okay, but I can expedite their departure and clean that room for them, but be aware of your surroundings all the time. You have to be able to do that in this profession. Probably in any practice, but I would say dermatology is incredibly fast paced. So it can be a little tough for someone that's not as multitasking.
Yeah. Because you mentioned 5 minutes, 8 minutes, appointments that are super short. I know I've gone to a dermatologist and I was surprised how quick my appointments were. So yeah, do you give people training? Because I know sometimes young people might think, well, how do I know if I can do that well? Do you expect everybody to know everything when they first get there, or is there some training period?
That's another thing when it comes to training. As we all know, our teachers, all the teachers we've had up to this point in our life have all taught us a little differently, and everyone learns differently. I need to be able to do the procedure, do the task on my computer. I can't have someone come in with their finger and tapping everything. I'm not going to learn it that way. And that's one thing I do feel with some of the younger people, that they're just so used to the technology. And a lot of people need to learn by doing. So you have to be patient and tell them and suggest, this is how I would do it. Everyone teaches differently. We've had a lot of training going on, and some of the people will get a little frustrated because they'll say, well, so-and-so told me this way. And this is where the OCD comes in, because you think that's the only way that it can be done. And that's not. There's multiple ways of doing everything, and it's good to learn different ways because it might be more comfortable for you. Did I answer your question?
Yeah, absolutely. I know another big question, Pam. We have about 9 minutes left. It goes so fast. What is the favorite part of your job versus the not so favorite part?
Well, I'm gonna tell you the not so favorite part first, and that's probably driving. I drive a good distance. I have to say I love driving. I love the vehicle I have. And I drive all over. But when you're looking at maybe where you want to be and what other aspects of your life, you want to have, I spend at least an hour, if not more, on the road every day. That includes to and from. But I'm fine with it. That's just how I want to live where I live, and I don't mind driving. So that would be my least favorite, just because then I've got traffic, you've got construction, you've got weather. So really, honestly, that's my least. What do I love the most about my job? I love my family here. I love the support that everyone gives each other, but I love the surgeries. I've been doing surgeries. We do large, complicated repairs because of a skin cancer taking more space and having to do a rotation flap or something. The doctors that I work with, Dr. Eng and Dr. Winstanley, they're amazing surgeons, but all of our providers are wonderful providers. They take good care of their patients, so that our logo is compassionate and caring service, and they really are. And that's one thing I've always wanted to give our patients. I'm not about a number. I'm not about telling someone that walks in the door, sorry, you don't have an appointment, we can't see you. No, we want to try and find a way to help you today. So surgery, helping people, and my family, they're my family.
Yeah, that's a very beautiful thing when you can have people at work that you really enjoy. Just because you mentioned the surgery, I just want to press into that a little bit because we have a surgical tech coming up on the series. So I want young people to understand that there's different jobs you can do similar things. So when you're actually in that surgery room, Pam, help them understand what kind of tasks you get to do while you're in there as a medical assistant.
Sure. So the doctor is going to perform everything. You have to have your surgical sterile tray already. You want to be that Girl Scout or that Boy Scout. You want to have everything in the kitchen sink. You want to think ahead so that you don't slow down any of the process. You make it as efficient as possible. And then you're in there assisting. It's kind of like a dance when you're handing instruments, certainly not fast, but carefully. And this is something that you would learn in school or if you were on the job. And then every provider, every surgeon works a little differently, and they like things done a little differently. And you just have to learn to go with that because it's not all the same. And then often with our doctors, then depending upon the type of repair, we get to put the top stitches in. Now, sometimes Dr. Eng uses glue. So, she applies the glue. Sometimes they don't have to get stitched. So that's kind of nice for the patient. And then sometimes we get to put the stitches in, and they do the key stitches. They do the key ones underneath that are going to hold this whole area together. And then they put in other key stitches on top, and then they hand it over to us. And then you're with that patient. The doctor leaves a room and you finish up, but you have nice conversation. You go over wound care with them, and then you put their bandage on, and then you enter them in the computer that they're at checkout and when they have to come back for suture removal. So there's always, maybe you have to send in the prescription. But yes, again, just being efficient, checking their medical, all their medications, whether or not they have heart valves, artificial joints, that type of thing. So there's always, and you learn all that, you are taught all that. And every practice will have a different way they want you to do things, and you just have to be flexible with that.
Yeah, and I think it's so great for young people to hear some of that specialty stuff you get to do, Pam. And I also just want to point out for a minute that medical assistants are needed in cardiac offices. They're needed in neurological offices. They're needed in orthopedic offices. So really any part of the body, you guys, that you're interested in, there's a medical assistant who's part of that practice. They're the ones that are, I would think, kind of people holding it all together at some level, because you're, like you say, you're doing so much to support that doctor. So be thinking about your own interests, everyone, and kind of find, you know, that direction to what else can I do in that field. But medical assistant across the board, you get to choose, again, what setting you want. And I love, Pam, that you ended up in dermatology. Is there any patient story that kind of stands out to you as far as where you know you really made a big difference in someone's life, that you slept really good that night because it was like, wow, this is
Yeah,
awesome.
I might cry. I don't know. We had this older gentleman that we saw, he and his wife for years, and she had a stroke. And so, you know, in our practice, you see people back on a fairly regular basis. They become like family. And his first name was Bob, I can tell you that. And when his wife had her stroke, he came in and he cried with my Dr. Vanderveen that passed away and I. And then when she was in the nursing facility, you know, he'd come in and he'd share his sadness with us. And then he got to an age where his son said, you need to move to a facility. And he didn't want to go. And he wanted me to see his house. So I said, well, I'll come over. He goes, well, and I'll take you out for dinner. So of course he was in his mid 80s now, and I had to drive, and that's all right. And so I got to see his house, and we went out to dinner. And then I had told my doctor how sad he was about having to leave. And when he was first at the nursing home, I was going to go see him on Christmas Eve. And my doctor said she'd come with, and she didn't do that kind of stuff. So we surprised Bob with a special blanket. And yeah, he has pictures of us he'd had. Unfortunately, he passed away here recently. But you get to meet people that are just so sweet and special, and you know you've touched them and they've touched our lives. So yeah, I miss Bob.
It's beautiful that you can share that kind of thing, Pam, because, you know, in the medical field, there's some people who work with a lot of patients, you know, all day long, and they might not get that relationship. And this is where I want the students to start self-assessing, you know, long-term care, for example, you get to really get to know your clients or patients, right?
Yes.
Dentist office, that you might be serving someone from the time that they're 10 up to the time they're, you know, 50. So again, young people, be thinking about what kind of relationships, because it sounds like for Pam, when you are meeting your patients so many years, that these kind of bonds happen. It's really beautiful, Pam. I'm going to share a resource with them so they can take some of this exploration to the next level. So why don't you think in a minute here, Pam, and just share that final word of wisdom to our young people and counselors that are on the call, and I'll be right back with you. So let me share my screen. So young people and counselors, this is always my favorite resource to share. onetonline.org. Again, when you put in, for example, medical assistant into that search bar, you'll come across some more information. So what I want to show you, when I put in medical assistant, look at all those different jobs that are very similar. Maybe you haven't thought about an ophthalmic medical technologist or technician, similar job, but in the eye industry. Look at this last one, medical appliance technician. So when you're looking at jobs, we heard about what a medical assistant is. Click on that, read more about it, find what a typical day is, what kind of skills they want, what kind of education, what kind of money you're going to make. That's what this tool is about. It really helps you take it to the next level, but it also gives you information about jobs you maybe never heard of. So I want to point that out. Also, I clipped this picture with this drop down, but there's pretty much an association for all occupations. So I just went to Google and put in medical assistant association, and sure enough, there is one. And I wanted to point out to the young people and counselors that when you go to these kind of sites, you're going to get a ton more information. So look at, they have under membership, they have how you can volunteer, they have a special student center, they have a special career center. So again, look at what your options are, what's happening new in the industry, what kind of training, what kind of scholarships there might be. So I just wanted to point that out as a resource too. I'll receive any follow-up questions you might have for Pam, and I'll get those to her. So Krista Harmon at kenisd.org. I know, right, Pam, you'll be happy to answer more questions if they have anything, if they're really excited about this.
Definitely.
So, yeah, so I'll put the sketch link in another time here for the counselors in the group. But what about a final word of wisdom?
You know, always be always ask questions. Don't be afraid. Be willing to learn. Know that things will change. Try to just be open to what other people are saying as well, and job shadow as much as you can. Even asking, I mean, if somebody wanted to come in and hang out with me on a day when I'm doing my cosmetic, I'll check with my office manager, but I'm sure that would be fine. Maybe we'll see about the surgery days, but yeah, definitely, I'd be open to that.
That's great. I meant to ask that if you guys in the past have done job shadows, and obviously with COVID, a lot of that's changed, but in the past, had you let students in just to kind of see what it's all about?
Oh,
So
yes,
that's great to
yes.
know. Good. That's inside scoop, everyone. You just
Yeah.
got it from Pam. Well, Pam, we really, really appreciate all of your time today to educate us about your field as a medical assistant, but even more about dermatology too. And just that's such a great, growing, changing field in itself. And so hopefully that piques some interest.
You too. Thank you.